Alright everyone, so I want to take the time to introduce you to our new module, which is the last of the semester. It's the ICM Pulmonary module. And we talk about respiratory medicine. There are some materials that I want you to become familiar with on Blackboard that'll get you ready to get running before day one starts. Now I know that you take Black Monday and after that you need some time to decompress, which I understand, but I do want you to come prepared, ready to go on day one. And so that's what this video is really intended to help with. If you go to course materials and you scroll down, my folder will be present right after Black Monday. Should be able to click here. Well, I should say, before we even get here, we have a day by day or lecture by lecture schedule that tells you what to be prepared for each day when you come to class. So as you'll notice, we did have more time for the cardio module this semester, so we are going to have to kind of crunch down and get all of the Pulm topics covered in a more timely fashion. So before you come to class on day one, there's really two things that we need to accomplish. Really, the first thing is a self-paced Nearpod lesson, which I'll show you in a second. There's an intro to Panopto, all of it's embedded in the Nearpod. And essentially, I want you to watch this lecture, work through the Nearpod lesson, and come prepared on day one. This lecture should be done all before you get to the first day, and that really just prepares you for the vocabulary of pulmonary medicine and kind of how to approach the patient, so that way when we start reading through cases, things just start clicking kind of from the get-go. Now, on Wednesday, the first day of our module, we will be covering the pleural disorders and tuberculosis lectures. So what this schedule tells you is what kind of activities we should be expecting in class, and it also tells us what we need to do, homework, before we come to class. Now, I know in other modules we did cases kind of fresh in class with our groups, but that takes pretty valuable time to be able to sit there and digest a case in real time during lecture. And in order for us to move through the Pulm module at the pace we need to move through, we're going to have to do some homework outside of class. And so any time you see this in the orange print, that is something that you will need to do either by yourself or with your group, preferably with your group, outside of class. And those are the cases. So that's what you should come to class prepared for. Once you get in class, this is what we'll be doing the day of class, and that's how it is for each of the lectures for the Pulm module. Once you go into the course materials, you'll see a little icon, a little nerdy icon that says start here, and that's where you'll want to start. This is where this video will be placed once I finish recording it, but essentially here I have kind of a what to do, the same thing that we're talking about right now. I know this is your last module and maybe you might be starting to feel kind of burnt out. I'll do my best to keep you excited, engaged during class and outside of class, to keep you motivated to keep going. The most important thing that you keep in mind is why you chose this profession to begin with. You likely chose it because you want to take care of future patients. You want to study like their lives depend on it. So on here in this little intro section, you'll find the PANS blueprint. And if you click that, it'll show you the blueprint exactly as it is from the NCCPA, all the different topics. And as you'll see in a sec, that's kind of how I try to break up the lecture days, is by larger topics. Oops. The other thing I have here is kind of an overview of the Pulm module, the schedule, and the objectives. So in case you didn't find it at the beginning, you can kind of open that up here, maybe. Oh, it's right here. Open that up, and it'll have the same schedule as on your Blackboard, and all the objectives for each of them. And I did redo the objectives for this year. So I kind of revamped them. They're ready to go for you to look through to help guide your study. So that's what I have in that little intro folder. Now if you go back to the module, there's a folder in here, one for each lecture category, lecture day. So this is the folder you'll start with before Wednesday. You'll want to complete all the activities in here. In each folder, they'll look similar to one another. In each folder, it should have the course objectives, the reading assignments, which are hyperlinked. So if I click here, it should take me to the book. If you're not on campus, you might have to log in through the My Access, which I'm here. That way you can read when you're at home. And you'll have all of your reading ready to go, ready to read through at a click of a button. I hyperlink Current, which is the one that I tend to use, and I also hyperlink Harrison's. Now, before day one, I do have a self-paced Nearpod lesson ready for you to go. It's all inclusive, so it actually houses the Panopto lecture. It houses this lecture that I have for you. It has everything in here ready to go. So you can either work through it here. So if I just put it here, and let's see, test, I can join the lesson, and it should take me through, allowing me to look at the Nearpod lesson in real time. There's quizzes, there's a whole bunch of different things in here for you to do, including my Panopto lecture, which is right here. You can watch through this. This will take you through the entire PowerPoint. There are some time stops with some quiz questions here for you to go through. And this is the Nearpod lesson I'd like for you to do before you come to class on day one. Have that all done, ready to go. Also before day one, you'll need to cover the material for the pleural disorders and the tuberculosis case. So for the pleural disorders, here are the objectives. Here are the readings again. On your end, you'll see lectures, which should be the PowerPoint presentations, pleural disorders and tuberculosis. And you'll find the cases, and it says, please review these cases with your group prior to coming to class. You should review them. It basically just has some blank templates for you to go through and go through the cases with your classmates. I don't have it up, but either way, go through those with your classmates. You can fill them out online, or you can, on the PowerPoint presentation, or you can upload them to Google Slides and kind of work on them together. There's also Panopto recording. So if you click here, there's Panopto recording for my pleural disorders, and there's also one for Dr. A's tuberculosis. Not all of my content categories have Panopto lectures. Some of them I don't like to reinvent the wheel. I kind of just use lectures that I find on YouTube that I think are relevant and pertinent. So just pay attention to that. If there's supplemental material, it'll be here. You usually have your osmosis, Paul Boland videos, and other things tagged here for you. So you'll have that. Each folder, it looks pretty similar. So you go into the infections, you'll have the same kind of layout each time. And then in class, we'll be going through Nearpod lessons. And when we go through those Nearpod lessons, after we're done, I will post them as self-paced lessons on each page so that you can go back through them on your own time. So that's pretty much, in a nutshell, kind of what I expect from you for each day of class. I do expect that you come to class prepared. If you don't come to class prepared, you're really not going to get out of it as much as you would if you were prepared. You might be a little lost. And I really don't want that of any of you, because we're going to move really quickly through the material. And there's really not a whole lot of forgiveness for catching up. So do your best. Study like your patients' lives depend on it. And make sure that you meet outside of class to go over your cases before you come in. So that's pretty much the gist of it. If you have any questions, there are discussion boards set up for your questions. There's a pulmonology one. I see that you haven't really been using them, but I like to use these discussion boards. If you just create a thread, you can ask a question, everybody can see it as well as I can see it, and we can learn together. So that's it. If you need anything throughout the module, feel free to reach out to me via email. I'll be happy to answer any questions for you. I'm excited. Really, really excited to teach you. I think ICM is probably one of my favorite things to teach, because it's so critical to the future career that you've gotten into. So And I'm a clinician by trade, so I want to teach you what I know. I'm going to teach you a lot of book med, some street med, and we're going to learn together. So see you guys in class.